Great. Okay. Well, folks, I'm delighted to be here with you today, and I certainly was delighted to receive the invitation to speak on this topic by CITL. So, as Darlene mentioned, my name is Tiffany Lee, and I'm a pharmacist and assistant professor at the School of Pharmacy at Memorial. I'm also the program director for the PharmD for Working Professionals program. So today I'm going to be speaking about incorporating student-constructed case studies into an applied learning course that is offered in our PharmD for Working Professionals program. I'm delighted today to have Emily Edison, who is a PharmD student in her very last semester of the program, join me today to share her experiences about learning in this context and also speaking about, I guess, the student experience related to constructing case studies and sharing them with her peers. So let me move on to my next slide. So today what I'd like to talk a little bit about is essentially what is applied learning. I'm going to talk briefly about instructional scaffolding and assessment scaffolding. I'll talk about student constructed case studies and practically explain how I built them into an online course, and then share with you some lessons learned. So before I begin, just to kind of situate the presentation today and tell you a little bit about myself and my teaching philosophy. So I do believe that learning is active and collaborative. And so the responsibility for learning doesn't just sit with the instructor, doesn't rely solely on the instructor. Rather, it's a shared experience. It's a shared responsibility between myself, my students, and the students working collaboratively together. So I tend to use a lot of active learning strategies in my courses and create opportunities for students to share their experiences. So students in the PharmD for Working Professionals program includes practicing pharmacists who are practicing right across Canada. And so they have lots of unique experiences to share with each other. So I'm committed to creating this, I guess, community of learners and whereby we all learn from each other. I also believe that learning and assessment go hand in hand. And so I'll talk about how I have designed an instructional scaffolding activity that also includes scaffolding of the assessment. So I wanted to give you a little bit of information about the PharmD for Working Professionals program first, sort of to provide some contextual information for how this activity was constructed and where the activity is placed in the program, so that you can sort of visualize it and think about how how you might apply it within your program or within your course. So Pharmacy 6930 is the final or the third applied learning course in our curriculum. And so the applied learning courses are really a part of our experiential learning curriculum. And because the students in our program are practicing pharmacists and they're actually part-time students, they get to apply what they learn at their practice site. And so Pharmacy 6930 is situated near the end of the program. So it's the third applied learning course, the final applied learning course before students actually go out to complete their placements. And so up to this point in time, students have done quite a bit of didactic learning. They would have already completed 2 applied learning courses. They have received quite a bit of instruction on various disease states. And so they're very well equipped at this stage to engage in contributing to the formation of case studies. And so the reason I wanted to share this with you is, if you think about your own program and where you might place an activity such as this, I would certainly suggest maybe thinking about applying it to a course after students have some experiential learning, some experiential education, or following their placements, for example. So if you teach in a cooperative program, perhaps after students come back from their rotations, this would be a great opportunity for them to share their experiences and what they've learned. So I also wanted to just tell you a little about the applied learning model in our program. So as I mentioned, the applied learning courses in our program are really a core component of the experiential curriculum. And so, with careful planning and development, these courses, these applied learning courses, have really allowed us to limit or reduce the number of experiential rotations that are required. So it's allowed us to reduce the number of weeks that students have to attend a practice site and to take time off work to complete their placement. And so this design was actually borrowed from the PharmD for Working Professionals program, or a similar type of program at the University of Florida. And the model was actually introduced into this program, not by myself, but by another faculty member at the School of Pharmacy, Dr. Kathy Balsam. And so I had sort of taken the opportunity then to develop or to contribute to the development of these 3 applied learning courses. So for today's presentation, I'm going to focus specifically on Applied Learning 3. And this is the course where, as I said, it's near the end of the program, and students have, already received a ton of foundational learning and teaching and learning opportunities. They would have been able to apply their knowledge previously. And so this just kind of builds on what they have learned. So what's the definition of applied learning? There's numerous definitions out there, of course, and I think this even goes back to John Dewey. But so what, I guess the definition that we applied when developing the PharmD for Working Professionals program, and specifically when thinking about these applied learning courses, comes from the Association of the American Colleges and Universities. And so, as they say, applied learning is an understanding and a disposition that a student builds across the curriculum and co-curriculum, from making simple connections among ideas and experiences to synthesizing and transferring learning to new complex situations within and beyond the campus. And so a lot of times when we use this terminology, applied learning, we relate it to experiential learning. And so some folks consider applied learning to be part of their service learning curriculum, for example. Others use the applied learning pedagogy when they are creating capstone projects, for example. And so I just wanted to kind of let you know the definition that we are working from today. And then also, there's some information that helps us frame exactly what applied learning is. So it's grounded in the conviction that learning is maximized when it is active. So students are actively engaged in the learning process, and collaborative. And so again, that word collaboration can be collaboration between the instructor and students, as well as collaboration between the students themselves, collaboration between students and their communities. And in the case of a lot of the applied learning courses in the PharmD for Working Professionals program, it's collaboration between students and patients and their other professionals who are situated or located at their practice site. So Pharmacy 6930 is an online course. So I designed this activity specifically to be delivered in the online learning environment. That being said, I think it is very applicable to on-campus teaching and learning. And in fact, we've considered ways to adapt this course to our other PharmD program, the Entry to Practice PharmD program, which is an on-campus program that is facilitated in the classroom. So for the Pharmacy 6930 course, it's predominantly delivered asynchronously. As I mentioned, these students are part-time students, they're working professionals, and so we don't have We don't require them to come together face-to-face at specific times. There is one mandatory synchronous sessions. And there are a number of live tutorials that are offered in the course. In addition, I tend to offer students virtual office hours. So I make myself available at a set time each week for students to join my office hours. And in addition, if students can't make the office hours, they can set up a time to meet with me. And we generally meet using, virtual platforms such as WebEx. And so the classroom discussion and collaborative learning in the online environment tends to happen on the discussion board. So a lot of our activities are facilitated using the discussion board. And then I'm very much, as I mentioned, an advocate for peer engagement and peer collaboration and assessment. And so the time commitment for this course, it's a 3-credit-hour course. So on average, I usually, encourage students to spend about 6 hours per week on their learning activities. So I just wanted to give you again some contextual information to kind of situate where this activity sits in this particular course. So it's of course it's delivered over 13 weeks. And the Applied Pharmaceutical Care Project, or the Applied P-Care Project, I often refer to it as, is delivered over a 4-week block near the end of the semester. And as I mentioned, it's important to keep in mind that this course is delivered near the end of the program. And so the students have a lot of the foundational knowledge and skills already at this point in time. So essentially, I have broken down the activity into smaller segments. So this is where the scaffold learning comes into play. And throughout each stage of the assessment and the learning activity, I guide students through sort of a framework to help build their knowledge and skills and refine their knowledge and skills, and also create this collaborative learning environment where everybody contributes to the learning experience. And so on your screen there, you can see how I've designed this project. So I've given you a lot of the practical details over the course of the next couple slides, just to ensure that you walk away feeling like you would have enough information to build this type of activity in your own course if you like. And so in the first week, students take the time to develop a case. And this is perhaps, it's not a new skill entirely for them, because they have quite a bit of exposure up to this point in time with patient cases. And as practicing healthcare professionals, they are reviewing patient cases all the time. They are sifting through a patient's medical record, for example. But this is the first time in this program where we ask them to actually build a mock case themselves. And so this required them to really think critically about all of the different components of a patient's health history that they would need. And so this was a bit of a challenge for them. They definitely had to use their prior knowledge and skills to pull together this case, but I supported them along the way. So what they did was they would have, in the first week, I would have given them, and I'll show you folks in a few moments, some tools and resources to help them build their case. And they had a choice to develop a case based on any disease states that they were comfortable with. And in fact, I encouraged them to think about the final exam or the oral exam in the course, think about the content that would be tested on that exam, and tailor their case to that content so that it helps them to study and prepare for that exam. So once they developed their case, they submitted their case to me, and then I went through their cases with a fine-tooth comb and helped them identify missing pieces of information. I asked them questions, I gave them feedback. I would have made suggestions within their case using track changes and so on. So they submitted these cases to me as a Word document. And then what we did, each student case was then assigned to one of their peers, okay? And I'm going to show you what this looks like using a visual diagram in just a moment. So every case was assigned a number. So let's say, for example, Emily's case was assigned number 1, my case is assigned number 2. So as the instructor, I would have assigned case number 2 to Emily, and then Emily's case would have been assigned to a different student. And so the students then had an opportunity to view a case that was constructed by one of their peers. And using their peers' case, they actually had to develop a care plan for the patient and document their care plan in the form of a SOAP note. And so that's what you see there in week 9. So over the second week, they worked through their peers' case and developed, as I said, a care plan and so on. Then in week 10, I sent back the SOAP notes to the original authors of the case, and they had to engage in peer review and feedback. And so I also evaluated each one of the SOAP notes and combined or collated our feedback and grading for the students and supported them along the way. And I'm going to show you more information about this in just a moment or so. And then in week 10 as well, the students with their original case had to develop a presentation to present that particular case to their peers. And then finally in week 11, they engaged in peer learning on the discussion board. So just to kind of situate this activity using Bloom's taxonomy, you know, applied learning, as the word applied indicates, sits at that application level, but this activity really, you know, requires application at the synthesis and evaluation levels of Bloom's classification system. And so this is that higher order or higher level thinking, you know, that the critical thinking that we want to see in our students. So it helps them to develop these skills and really develop a solid knowledge of the management of these particular diseases. Let me move on to the next slide here. Oh, it's just a duplicate. Sorry about that, folks. Okay, so in terms of the applied learning project, as I mentioned, this was all completed online, and the students would have had access to the Brightspace course site, which in fact was developed in collaboration with CITL. So this particular course, we had the assistance of an instructional designer back in 2018, 2019, when the course was developed. And so a lot of the instructions are laid out for the students in step-by-step fashion. And you can see here, I've, you know, explicitly provided to them the learning objectives for the activity, as well as required readings to help them along the way. So this information, as I said, is shared with them in Brightspace. And then just a word about scaffolding before moving on. You know, throughout each stage of the project, I guided students through sort of a framework to help them design their case, to, you know, evaluate their case, how it actually performed in terms of, you know, a peer taking their case and working it up. And then we created this community of learners by sharing our cases with the larger group in the form of presentations. So it really was about scaffolding the activity, scaffolding the instruction, and so on. So, you know, why is scaffolding assignments an important part of student learning? For me, I feel that it helps students master the intended learning outcomes of the assessment by breaking it down into smaller bits so that, you know, the cognitive tasks are more manageable. It also recognizes that learning is a process, right? And one skill can be achieved or mastered before moving on to the next. It provides students with an opportunity to receive feedback from their instructors, so that formative assessment is very, very helpful and helps strengthen their learning of the concept. And it really does foster higher levels of critical thinking. as students are guided through the learning activity. So the scaffolding comes into play here with the analogy of, removing pieces of the scaffold and letting students work more independently. So we support them in the beginning, giving them the tools and resources that they need, and gradually promote that independence. And so even though these students in the Working Professional PharmD program are adult learners and they have quite a bit of practice experience, the development of a case and engaging in peer review was, it's not necessarily a new task, but perhaps one that they haven't had a lot of experience with. And so this activity really helped them in achieving the learning objectives and goals for the course. And so along the way, I used the online tools in Brightspace to really help provide clarity on the activity as well as what the expectations for success were. And so I often within Brightspace use the video note function. So this is available both within the announcements widget as well as within the discussion board, for example. And so instead of using written text to provide a description of the project, what I did was, engage in using that video note. And that also appeals to various different learning styles. I find some students really want that, they really want those videos to help them understand what the expectations are, whereas some other students would rather just have the transcript of the video or have the text and work through it that way. So I try to mix it up and ensure that I provide a variety of tools and resources. So in this particular video note, I went through step by step what the expectations were for the activity and talked about how they can engage in the activity to ensure success. And, I would have provided these little video notes, as I said, in the announcements section of the course and also on the discussion board. So this is just one example. I also, as I mentioned, provided them with a visual to demonstrate really what how the activity would be broken down and how the cases would be distributed. And so this was a sort of a visual that I created and shared with them as an announcement. And so just to kind of elaborate a little bit, let's say we have 3 students in our class, so Tiffany, Stephen, and Lisa. So each student develops a case, and then each case is assigned a number. So the student is not identified as having developed the case at all. I removed the student's name from the case. There was no way that their peers could identify who had written that particular case. So Tiffany, for example, developed case number 1, but would have been assigned case number 3. And case number 3 would have been developed by one of her peers, Lisa. Oh, sorry, let me go back. And so Tiffany would have used case number 3 to write her SOAP note. So she would have worked up the patient presented in case number 3 and documented the care using a SOAP note. And then Lisa, as you can see, if you move down through the schematic, Lisa would have actually evaluated Tiffany's SOAP note. Okay, so that's the original author of the case evaluated the SOAP notes that were submitted. And I did this intentionally so that students could actually see how their case that they constructed performed in real life. And it gave the students an opportunity to learn from each other, learn how their peers would have constructed a case. And it also helps them to, it provides insight into how the instructor works through an assessment rubric. And in fact, I would have given them access to an assessment rubric to evaluate these cases. And then finally, you would present the case that you developed. So that's sort of a visual description or a visual, I guess, of how the project was organized. If you have any questions about that, certainly we can talk about that a little bit more near the end of the session today. And as I mentioned, there was quite a bit of follow-up and feedback provided to students. And so this is really important for, a complex activity or a complex project. It's important for us as instructors to be engaged throughout each step and to provide support to our students. And so because this course was delivered online, a lot of the support and encouragement happens through email, could happen through meetings with students, and so on. But in this case, this is an example of an announcement that I would have made on the discussion board. And again, a second announcement that would have been published on the discussion board, or sorry, as an announcement in the course. So this provides, again, explicit instruction on the expectations. Okay. Sorry about that, folks. My slides are freezing up a little bit there. So I'm just going to now take a moment to walk you through each part of the activity to demonstrate, I guess, how you might consider setting up a complex activity such as this one. So as I mentioned, step one focused on case development. So in helping students construct their cases, I gave them templates to use. So they would have had to, just like a patient in real life, they would have had laboratory investigations, diagnostic imaging investigations, reports from other providers, and so on within their chart or within their health record. And so the students were expected to develop these, but I gave them samples that they could use. So you can see all of the Word documents here are linked within the instructions for the activity. I also gave them a case from that was constructed from start to finish, so that they had something to use as an exemplar. So this really demonstrated to the student what the expectations were. And I went over this as well in a tutorial session with the students. So this was part one of the activity. So they developed the case, I received the case, and then would have reviewed it and provided them with suggestions on how to improve the case. And, talk about, I would have given them feedback on how the case could be improved and any missing elements that were present. So it really promoted learning, because it forced the students, I guess, to think really critically about what information they need in order to make this case usable by one of their peers. Okay, and then step two, as I mentioned, was the case workup and documentation. So they would have received a case from, that I assigned them, that a peer had developed, and worked up that patient and documented their care using the SOAP note template. And so again, providing them with all of the tools and resources that they need. So the SOAP note template was provided. Earlier in the program, they have lots of experience with using this template at this point in time. But again, just I provided it to them so that they had it available when they needed to use it. Then they engaged in peer evaluation and feedback using a rubric that again was provided to them, and they would have seen this rubric before. Every time we have students in our program write a SOAP note, we do provide the rubric to them so that they know what the expectations are. But for this particular activity, they had to use the rubric to grade the submission of one of their peers. And again, they didn't know who the peer was. Everything was anonymous. I removed all of the names. And then I also evaluated the SOAP notes that were submitted using this rubric and collated the feedback provided by the peer as well as my feedback before distributing it to the students. Then they had to work on developing a presentation. So this presentation, as I mentioned, was for the original case that they developed. And so there was quite a bit of detail provided to them in the course site. So in the Brightspace course site, I provided them with lots of information about what the expectations were. I talked to them about, what tools, I guess, and resources for developing a PowerPoint presentation, how they should do their recording, how they should upload their recording, and so on. And again, gave them access to an assessment rubric, as you'll see on the slide there. Oh, sorry. And then the final step was this peer learning. So each of the students, after they developed their presentation and recorded their presentation, they shared that link to the YouTube video, which was on an unlisted YouTube video, of course. They shared the link to their recording on the discussion board. And then each student in the course were expected to review 5 presentations by their peers. So again, it's contributing to this, creating this community of learners. So they would have reviewed 5 presentations by their peers and asked thoughtful questions. And so this is to stimulate that discussion and to contribute to the learning experience. And similarly, I would have been engaged with these, with the students on the discussion board as well, posing questions and encouraging greater thought as well. And, you know, if a student, for example, asked a question, I felt like there was a missing element to the question that they posed, I would have chimed in on the discussion board about that as well. So there was lots of learning happening over this 4-week period. The student constructed cases were an absolute wonderful learning experience. And I believe it really helped students solidify their learning from start to finish. So it really helped them put into action, I suppose, all of the prior learning that they had obtained from various different courses in our program. And, you know, one of the critical pieces of this activity is instructor feedback. So it was, you know, quite onerous on my end to engage with providing feedback along the way. So there was a lot of time that I spent reviewing their cases, you know, providing constructive feedback on their cases. I would have reviewed their SOAP notes, as I mentioned, and developed my own assessment of their performance on the SOAP note. And then as well, you know, engaging with them on the discussion board, evaluating their presentations, and so on. So there was, you know, a lot of instructor feedback provided along the way, and also encouragement. So, you know, I firmly believe that students do well when they are supported by their instructor and when they know that their instructor believes in them. And so along the way, you know, I would send out emails. I would congratulate them on developing, you know, a really robust case, and always kind of ensuring that there was positivity, I suppose, around the hard work that they were doing. And I was really excited to see these cases put into action and to see the learning happen on the discussion board was so meaningful to me. And I could see that, you know, the light bulbs were going off and students were really getting the disease states in a different way, and they were learning from each other, and that really helped them develop their confidence in their own knowledge as well. And so I just wanted to give you some other examples of how, you know, I engage in providing encouragement. So these are some examples of announcements that I would have posted. So because, you know, when I review these 19 cases or these 20 cases, I did notice that there were some common pieces of information that were missing from the cases. Or I noticed that students weren't getting a certain concept very well. And so what I did then was I created a thread on the discussion board to talk about those things that I had observed. So you'll see this in the last announcement here on the screen. It talks about me notifying them that I was going to, you know, post a new discussion thread to talk about concepts related to the development of PCARE cases, and encouraging them to engage with the discussion, and to review the concepts that were discussed within those different posts. And so this is an example of what it would look like on the discussion board. So again, I attempted to use both the video note tool within the discussion board to talk about these various different concepts, as well as written text. And so you can see some examples here. So one of the activities related to clinical trial directed medication therapy, so there was a lot of discussion about that, assessment of renal function, ordering, and reporting labs. Okay, so there was a lot of peer learning and feedback that happened along the way. And as you can see, I've pointed out the 4 different areas where students were engaged with their peer, where they collaborated with their peer, provided feedback, and so on. And, you know, learning from and with peers, I certainly believe that adult learners not only, you know, deepen the learning, but they develop this additional support system. And so for me, building this community of learners is really valuable to their learning experience, but also to their connections and networks outside of the classroom, especially for an online course. And then, you know, working with others in this capacity, and given that they're all practicing pharmacists as well, it really increases that, I guess, social emotional memories of the learning experience, and creates those connections that I believe really helps build their confidence. And in fact, that's one of the key areas that I see our graduates have developed over the course of the program, is in building their level of confidence and their connections with their peers and that support system. And, you know, even though this was an online course, and some, you know, might say it's difficult to build that community of learners in an online program, I personally find that having access to these digital tools wonderful. And I don't think it really takes away from the learning experience. I think it's just, we need to design our activities differently and make use of those digital learning tools in a manner that really promotes and supports collaboration amongst students. Lessons learned. Okay, so one of the things that I realized was that I was probably a bit too ambitious with my own ability to turn the case review around quickly. So as you can see from the slide here, students submitted their cases for review to me in week 8. And then I had to get those cases out to their peers within a couple of days. And that was not realistic, folks. So what I would do when offering this course again, and when using this activity in the future, is actually allow at least 1 week for review of those cases. And that also would allow students to reflect on the feedback that I'm providing them as well before submitting the revisions to their case. So you really need another week between these 2 different parts of the activity. So that was probably the most important lesson that I learned, is to judge your time appropriately. So although it, you know, promoted in-depth learning, there are some changes that I would make. I would definitely extend this project in the future over 5 weeks. So it was, you know, as you saw a few slides ago, delivered over 4 weeks. So I would extend it, particularly that case review piece, over 1 full week. Another piece of this is that planning and organization are critical. So this is a very time-sensitive project, right? You have to be able to get your feedback to the students relatively quickly. And so you want to block off time in your calendar to be able to do, to review student submissions. So blocking off dedicated time is an absolute must. you also need to be pretty organized. So, you know, I had a spreadsheet, an Excel spreadsheet where I had each of the students' cases numbered. I knew who I had assigned that case to. I kept all my comments in that spreadsheet so I could look back at the student performance to identify if there were any common, you know, observations that I would like to, you know, discuss with them related to various different concepts on the discussion board. So that really helped me as well to visualize student performance. So organization is definitely key, and planning and dedicating time to review the various different submissions that are coming in. And so, as I mentioned, the first time that this activity was incorporated into the program, I think I had about 19 students in the course at the time. And so if you had a class larger than that, I would encourage perhaps the use of teaching assistants if you have access to teaching assistants in your program, but definitely, you know, getting the support of other members of your faculty, perhaps, or teaching supports within your faculty in order to be able to turn the feedback around quickly and ensure that it's meaningful for the students. And I tend to be the type of person that really goes overboard with feedback, and I provide a lot of feedback to my students. Sometimes, you know, I don't know if it's always necessary to give as much feedback. So I probably need to adjust my expectations of myself as well, to be quite honest. So I just wanted to share some of my lessons that I've learned throughout this process with you. And now I'm actually going to turn it over to Emily to tell you a little bit about her experience as being a student on the receiving end of the activity. So Emily, it's over to you.
Thank you. Hi everyone. So as Dr. Lee mentioned, my name is Emily Edison, and I am actually in the last leg of my PharmD for Working Professionals program. So I'm just completing my final work term now. So I've actually been fortunate enough to be I'm both taught by Dr. Lee, and I'm actually currently working alongside her throughout this work term. So she's certainly had a positive impact on my growth as a pharmacist and a student. So just want to thank her for that for sure. So in terms of our applied learning case back in 6903, I felt that developing a patient case really contributed greatly to my experience as a student and as a community pharmacist. So while I was doing this program, excuse me, I was working as a community pharmacist as well. So this project was helpful in that it allowed me to start from scratch and create a patient case that I felt would be helpful in assisting both my own learning and then another pharmacist as well, and all the peers that reviewed my presentation at the end. So this allowed me to focus on each piece of the puzzle in a patient case and not just the obvious drug therapy problems that I look at every day during my community pharmacist role. So considering patient factors, allergies, family support, insurance, adherence, and so much more really. And these are all important factors, especially in real life practice and when forming a case for another learner. So it's important to try and think about all the alternative angles because as we know, there's so many different ways that case-based learning can be approached, especially when you have so many different learners involved. So for example, just being in the heights of flu season and COVID-19 right now, if you develop a case and you forget to mention injection, so if your patient has had up-to-date COVID-19 vaccinations and the flu shot or the pneumococcal vaccine, if that's an oversight on my part, then of course Dr. Lee would have a look at my case and probably mention to me to add it in because my peer may say, oh, well, I'm going to add that in now as a drug therapy problem, perhaps not as a high priority one that they focus on, but then that's something that I oversighted in the beginning. So you certainly have to take a step back and think outside the box because it's not just yourself that's going to be reviewing the case. There's so many other people with different backgrounds and such. So that kind of gets into my next point. With the PharmD class, we have numerous students from various backgrounds. So that could be community pharmacy experience, hospital pharmacy, And then specialize, like I'm in the thrombosis clinic now at Eastern Health. So these pharmacists are certainly very knowledgeable about that particular area. And there's also some people I'm sure that's involved in research and other areas. And they also are located in different parts of the country. So as you can see from the illustration there, pharmacy practice looks a little different depending on the province in which you practice in. So the expanded scope of practice differs, as well as the provincial coverage of medication and things like antibiotic susceptibility rates, and there's so many other examples. So then when you are discussing and trying to work collaboratively with other pharmacists in this area, there's so many points that can be discussed. And although our core knowledge is the same, and we do actually do the same licensing exam, our work experience and area of expertise certainly differ. And I also feel getting to work with these other pharmacists and collaborate, I feel that it gives us the opportunity to challenge each other in a healthy way, of course, with some outside the box thinking, which often sparks some awesome conversation. And in my opinion, some of that conversation and even just in the discussion board there, just getting things going back and forth, that can be some extremely, beneficial learning points to take away, not only from a practice standpoint, but even just bring it into patient cases in real life. So once the patient case had been developed, so we did that individually, of course, and we had to create a slideshow after that and upload our individual presentation so that everybody could get in and have a look. And of course, I went in and had to review patient cases from other peers. So I had to walk through my own case and draw attention to areas that I felt were important, and then walk through what I felt was important in terms of bringing up the drug therapy problems and how I would go about formulating a plan for each patient. And then, of course, everybody was able to view that. So then, as Dr. Lee mentioned, we were obligated to review, I think, 5 patient cases, and then comment on 2. So any pharmacist from any area could comment on anything. So I felt like there was so much discussion from this. And because it was uploaded and it was free for viewing, I found this portion of the activity also, I felt people were going back in weeks to come, even once this kind of was gone on throughout the semester, people were still going back and watching presentations and often just putting in those comments. You didn't have to go back, but because it was there and available for us to go back to, as I mentioned, all of us are often working. Some people have families, some people have extracurricular activities. So having this, video there, you're able to go in, watch, and comment if you like, read the questions and go back and comment when you get the time. I felt that was something that was really practical for my learning, and it really did seem like other people's as well, because I kept going back to look and there was always added questions, added comments. So I thought that was really meaningful in my learning. So as I mentioned, I regularly practice in a community pharmacy setting, which entails a lot of inter and intra-professional collaboration with other healthcare professionals, but it also gives me the opportunity to take students. I have not done that yet, but I definitely hope to. So often students will come in a 4 to 6 week block and have a variety of learning objectives that we have to kind of go over and try and help them, get to the end of the placement, having, increased their knowledge for sure. So when I work with students, I feel that often I'm learning just as much from the experience as they do. Certainly I haven't had one of my own, but I have worked in environments where they have been there. So this case-based learning enabled me to expand my knowledge and critical thinking skills, and I feel that I can incorporate this approach into my ability to help educate future students in the role of a preceptor. So within the project, we had the opportunity to grade our peers, constructively on their SOAP notes, and then we also received the feedback from our peers. So forming this skill is super important. I often struggle with it a little bit. I love receiving constructive criticism because during this program, we had plenty of opportunities to do self-reflection And I find that I enjoy self-reflection, but when you've got a word, you know, constructive criticism from other areas of, like from your peers or from your professors, then it kind of helps. You can look at yourself and say, okay, well, maybe these are the areas I need to improve on. How do I reflect on that? How do I go forward from here? But then when I go to give someone constructive criticism, I do find it is a little challenging. It's something that, of course, we need to practice and work on. And because at the end of the day, we're all, like, pharmacy is a profession in which it's growing, and the expanded scope is growing. And then we do need to commit ourselves to expanding, you know, our knowledge every day. We should be learning something new every day. So learning how to take that constructive criticism and then also give it is, I think, a pivotal role in how we, you know, grow forward. So being able to kind of provide that to a peer and then get some back from a peer, I do think that was probably my favorite aspect of this assignment. I did enjoy, of course, the case-based, coming up with a case. I felt that that was very interesting and important. But for me, I think that providing that feedback to another peer, of course, trying to sandwich it, you know, some good things, some things to improve on, some more good things, and that kind of thing. But I do think that that was really helpful for me. So overall, I really did enjoy the assignment. Like you said, you did have to put in the work to get what you wanted to get out of it, but I do think it was a great opportunity.
Okay, thank you, Emily. And folks, that's it for us. So we'll turn it over to you now to ask some questions. With that, I think what I'll do is I'll stop sharing my screen and can see you all. Any questions for us? Just going back through the chat there. I don't see any questions for us in the chat.
I have a question.
Sure.
Hi, I'm Lori. I use case studies in, sorry, my camera's kind of all over, the Faculty of Education. I love case studies, and I really love the neat way that you constructed this. One thing I'm curious about is actually the assessment piece. There are various parts. Do you assess them as pass fail? Do you assign grades? What about the peer, the constructive grading, as Emily talked about? What is that exactly? Thank you.
Yes. Thank you for asking that question. My apologies. I meant to talk about that. I got so excited and moved on from it. So this is a pass-fail course, and generally what I do, and it depends, if, you know, some courses I take a different approach, but this particular course being pass-fail, I do tend to have I guess expectations around what the minimum level of performance is to achieve a grade of pass. And so I would do the assessment on my end and let the students know if they met the expectations for a grade of pass. With the peer feedback, that was provided to the students more in a formative way. So students were required to receive a grade of pass on the feedback portion. They're required to submit their peer feedback and to provide some constructive feedback to their peers. However, you know, they got a grade of pass as long as they completed that activity. So I would have taken that feedback and added it onto mine and then send out the overall grade, which included the use of that rubric to the student. But I don't use the peers grading as, how do I put this? I don't use that in determining the grade in the course, if that makes sense, or on the activity. The grade on the activity is solely based on my assessment of the student, but I give the students an opportunity to engage in peer feedback, as Emily alluded to, as a way to develop their skills in providing constructive feedback to a peer. But they are required to complete that portion of the activity. So at each particular step or part in the project, they would have gotten a a notation in the grade book around pass or fail for that specific part of the activity. I should have showed the grade book actually, how I had developed that. Hopefully, does that answer your question? Lori? Any other questions for us? Hi, Jennifer.
Great presentation. No real questions as such. I just wanted to say it was a really lovely presentation. And well, I don't use that much in the way of case studies. It was just the approach in terms of the scaffolding. It made me think a little bit more of some of the activities I do in my course. So I may follow up later about that, but great job.
Absolutely, Jennifer. I tend to do a lot of scaffolding in the working professional program. In my other applied learning course, I also take a similar sort of approach. And I developed this approach, not, how do I put it, almost through trial and error, if that makes sense. And from my experiences as well as a learner. So in my graduate program, I found my instructors tended to break assignments into smaller pieces, and that gives you an opportunity to review and revise your work before the final submission, which students, especially students who are working professionals, they really value that opportunity.
Yeah. I think I'm using a little bit of that approach, but I never really considered it as a formal approach. And maybe there's a more a better way that I can approach it to, but I love it.
I know, Jennifer, you've completed the teaching skills enhancement program that's offered through CITL as well. And I remember it was introduced in that course. And then since that time, back in when we were developing this program, I did a bit of reading. There's a lot of literature out there on scaffolding.
I was Googling as you were talking. I was like, oh, I'm actually doing a bit of this, but not formally enough. Like, I think I could learn a bit more to enhance what I'm already doing in the classroom. So
I feel the same, actually. And sometimes I feel like I can apply it in other courses where I'm not making use of that particular approach to strengthen certain activities, for sure. Okay, it's 3 p.m. Darlene, do we have a hard stop at 3? Or do we have time? Do we have time?
We have time for another question if you want to, if there's any others.
Great question, Lori. So what are SOAP notes? We used that terminology a lot, didn't we, Lori? And we didn't explain it very well, or I didn't explain it very well. So I take full responsibility for that one. So SOAP notes are essentially a format for documentation within the health disciplines. So when we perform a patient assessment, we have what we call subjective and objective findings. So subjective is the S in SOAP note, objective is the O in SOAP note. So subjective findings are those things that the patient reports, but we cannot confirm. So if you say you are experiencing pain, for example, and I say, okay, on a scale of 0 to 10, where 0 is no pain, 10 is extreme pain, where does your pain land? And if you say 5, I would report that in the subjective section of a SOAP note. Objective findings relate to things that can be confirmed. So these would be laboratory tests, for example, diagnostic imaging reports, and so on. And then the A is assessment. So it's our assessment of what the patient's presenting complaint is. And so for pharmacists, that assessment often relates to medication therapy and how medication therapy can be improved or adjusted or so on. And then the P is plan. So what is our plan for resolving the problem? So SOAP is an acronym for subjective, objective, assessment, and plan. And it's just one of the tools that we use to document care. And so this is considered the universal documentation style in the health disciplines. So we really teach our students to document their findings in that manner. And so when we present cases to students in our program, we ask them to work up the patients to identify what the problems are and identify how you're going to resolve those problems. And they would submit a SOAP note, which outlines their findings and their plan for for the patient. So my apologies, Lori, for using some of the acronyms that might not be familiar to everybody, but thank you for asking the question for sure.
Oh, that's no problem. It's interesting, and I think I can adapt it in my education classes. I like the format. That's great. Thanks a
Awesome.
lot. Very, very interesting, very, very helpful. And I absolutely love the idea of case studies. I think it's a very valuable teaching tool. Thanks so much for a great presentation.
Thank you, Lori. Appreciate it.
Okay.
Any other questions for us? Okay, so I guess I'll turn it over to Darlene in a moment to clue up the session today, but I just wanted to say a big thank you again to Emily, who's taking time out of her day on her final rotation to join us to share her experiences. So thank you, Emily.